Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. On today's episode, we're going to be talking about common as well as some lesser-known side effects of the birth control pill. I'll tell you about a huge study done in Denmark that looks at increased mental health concerns for women on the pill. And finally, we will discuss better options for managing your menstrual health concerns, fertility concerns, and what to do for treatment when birth control is the only option that you are presented. So let's start off today with a patient story about a client of mine who we'll call Jenny. Now, Jenny went to see a different primary care doctor because she was having irregular cycles. And the first option she was given to correct those irregular cycles was being put on the birth control pill. Jenny did ask about any side effects of the pill that she would experience, and she was told that if anything, she might notice a little bit of irregular bleeding initially, but that it would go away after a couple of months. That was it. That was the end of the discussion on birth control pill side effects. Disappointed, Jenny had asked if there were any other options, and after she was told no, she was given a prescription for the pill and told to let her doctor know if she had any problems with it and was sent on her way. Now, when Jenny got to the pharmacy, she started reading about all the potential side effects listed on the package insert. She was pretty terrified to see so many side effects listed that her doctor had not reviewed with her, like the potential for blood clots, mood changes, stroke. Being a discerning individual, Jenny ended up deciding not to start taking the birth control pill, and a friend of hers told her about my clinic. Jenny came to see our team for additional evaluation of her irregular periods instead. She worked with us to learn a charting method, to diagnose the underlying cause of her irregular cycles, and together we worked on a comprehensive treatment plan that helped her avoid the potential side effects and long-term consequences of being on artificial hormones that would have just masked her symptoms. Now, you probably know someone, or maybe you are the one who can relate to Jenny's story. This is unfortunately the norm in many doctors' offices, and the birth control pill is seen as a quick fix for anything that is wrong with your menstrual cycles or the symptoms that you experience. I often will explain to people how to try and understand a doctor's prescribing habits for the birth control pill in this way. If you are a female who comes into their doctor's office complaining of acne that is worse around the time of your period, there is a good chance you will walk out of that office with a prescription in hand for birth control. However, if you are a male who has the same complaint of acne that is worse during 1 week of the month, there is no way you would get handed a prescription for birth control. Why do we think it's okay to treat women with that option when there is no way we would give men that same prescription with potential side effects of artificial hormones just to treat acne? The harsh reality of healthcare in general is that we see many doctors do not have the time and are unable to make the time to go over all of the potential side effects of medications, even the common ones. Even if doctors are asked by patients about side effects, they may not be aware of all of them. And let's face it, no person has time to memorize every single side effect for every single medication out there. So give your doctors a break. Now, this is not to make excuses for the individuals who are prescribing the medications, but it's just the reality of the situation. Furthermore, if the potential side effects are seen as less problematic or rare, sometimes they just aren't mentioned at all, especially if your healthcare professional has not ever personally seen that side effect in clinical practice. Now, for the rest of this episode, I'm going to just be referring to oral contraceptive pills as the pill, which will include any artificial hormonal pill that works as contraception. As we discuss the following side effects, please keep in mind that research estimates show that 60% of women discontinue at least one form or another of the pill within the first year of use, mostly because of side effects they experience. So let's talk specifically about some of those side effects that Jenny read on the package insert that was on the pill that she had been prescribed. The first side effect that is typically listed is breakthrough bleeding, irregular cycles, or heavy menstrual bleeding, which is quite common. In fact, it's seen in upwards of 50% of women having some type of irregular bleeding on at least one form of the pill. Unfortunately, a lot of women aren't told about this, and it really can be a combination of factors that causes the bleeding troubles. Whether there is an underlying anatomic abnormality that wasn't properly evaluated, a bleeding disorder, or perhaps you're trying to correct the wrong hormonal imbalance and adding too much artificial estrogen into your body. Irregular bleeding is the number one reason that women discontinue the pill because they refuse to tolerate the erratic bleeding, which may have been a reason for trying to start the pill in the first place. Another very common side effect that impacts at least 40 to 45% of women is mood changes, and most commonly, depression. There is a fascinating research study that was done in Denmark and completed about 10 years ago. Now, this research looked at data of over 1 million women over the course of 18 years. And what they found over time is that even when they accounted for all other factors, that women that were placed on the pill were 1.5 to 2 times more likely to be started on an antidepressant medication over the time frame that they were followed in this study. In a later follow-up study, the researchers found that these women on the pill were more likely to have a suicide attempt or to die from suicide. Across the board, these findings were more significant if the woman was started on birth control pills at a younger age. And again, this goes back to scientific evidence that a young teenager's developing brain is much more sensitive to these hormones and to the chemical exposures that they have during this time frame. When we are seeing healthcare professionals start these young women on birth control pills at younger and younger ages, it absolutely is making a huge negative impact on the development of their brain, which then impacts their mental health, even after the pill has been discontinued. If for no other reason but this one alone, the pill should be completely eliminated as an option for treatment for any woman, and especially for younger women. Other common side effects that we see on the pill include weight gain. Now, depending upon what type of pill you're taking, this may range anywhere from a couple of pounds upwards to 20 pounds or more. Another very common thing that I see in practice is women who have gastrointestinal problems, whether that's abdominal cramping or nausea, irritable bowel syndrome, or development of food intolerances. We know that the pill causes many different nutritional deficiencies because it changes the absorption of those nutrients in our diet, which impacts our overall health and can lead to troubles with our gut health. Now, I'm going to take a small sidebar here to talk about some of the common nutritional deficiencies caused by the pill because of their impact on other side effects that develop if you are lacking these vital nutrients. Now, the manufacturers of the pill do note that you can have nutritional deficiencies, and they recommend for this reason that you are taking additional vitamins and supplements to offset these deficiencies that develop. Folic acid is one of those nutrients, and it is important for neural tube development in a developing embryo. Now, I realize that much of the time, women are taking birth control are specifically trying to not get pregnant. However, we know that pregnancies do still occur when women are taking the pill. If they get pregnant and are deficient on folic acid already because of the birth control pill, this can have significant implications for that developing baby. Other common nutritional deficiencies from the pill include the B vitamins, B2, B6, and B12. Now, vitamin B6 is especially notable because if we don't have enough vitamin B6, it is a direct link to mental health problems because we need it to help with utilization of serotonin, which is one of the good neurochemicals in the brain for mental health. Vitamin B6 is also responsible for preventing blood clots. And when you have a deficiency in B6, this adds to the risk of blood clots when you are taking the pill. Vitamin B12 is needed for development of blood cells, and adequate levels help to prevent anemia or low blood counts. Low levels of vitamin B12 are also directly correlated with long-term cognitive functioning, memory, and neuropathy, which is numbness or tingling. Other vitamin deficiencies from being on the pill include vitamins A, C, and E, and all of these are responsible for helping with immune function as well as overall health of your body and your skin. We also note a decrease in mineral absorption when you are taking the pill, and these are considered to be your micronutrients. So specifically deficient in women on the pill are iron, copper, magnesium, selenium, zinc, and coenzyme Q10. And interestingly enough, many of these minerals are really crucial for blood development as antioxidants to prevent against free radical damage that causes cancers, as well as for thyroid and hormone health. If you are deficient on any of these minerals, it can really throw off your hormones both short-term and long-term and deplete your reserves. More importantly, it puts you at increased risk for the development of infections, cancers, blood clots, and other long-term health consequences. Now, while you can replete your stores of these vital minerals and vitamins, it can take quite some time, even after stopping the pill, to get your body back to optimal levels and restore your gut health back to baseline. Beyond nutritional deficiencies, we still have many other side effects, which may include decreased libido and breast tenderness. Since you're altering the hormone levels with artificial hormone intake, all of your hormone receptors will be impacted, including those in your pelvic organs, your genitals, and your breast tissue. Now, there are also lots of other side effects from the pill which are less common, but can be more problematic and sometimes even life-threatening. One of the more common ones that we see in this category would include blood clots. Now, this would include blood clots that occur in your leg or your arm, in your lungs, or elsewhere in your body. And once a blood clot develops, parts of it can actually travel throughout your body. So even if you start off with a blood clot in your leg, it can travel to your heart to cause a heart attack, or even up to your brain and cause a stroke. Now, although clots are considered to be rare in the general population of women on the pill, it is a very real and very dangerous side effect that no one should ever be exposed to unnecessarily. Along with these heart and vascular risks, we also can see issues with elevations in blood pressure in women who are on the pill. Another rare but serious consequence that can develop on the pill is different types of cancers or tumors. One mechanism of action for this is having a deficiency in the antioxidants that help protect against cancers, like coenzyme Q10, as we talked about earlier. If you don't have enough of this, the changes that your cells make can become cancerous without your body having those protective mechanisms to repair and eliminate these cells. The other important thing to note is the type of hormones that you are getting in the pill. Now, the pill is made from synthetic progesterone, synthetic estrogen, and this is not bioidentical. It is not the same stuff that your body naturally would be producing. In fact, they are chemically a different structure than what your body would naturally produce, and in much different quantities, often designed to be a steady-state dose over time, rather than fluctuating like your body normally would with your ovulatory cycling. Now, when you are receiving these higher doses of artificial hormones beyond what is physiologically normal over an extended period of time, we see an increased risk of particularly breast cancer and cervical cancer. We know that both of these types of cancers can be extremely sensitive to female hormones like progesterone and estrogen. And when you're being given higher than normal amounts of these hormones over time, your cancer may increase, especially if you have a hormone-sensitive cancer that develops. The other types of growths that are observed in women on the pill include tumors in the liver. Now, these aren't necessarily cancerous masses, but they are concerning to monitor and can cause problems over time as far as overall functioning and filtration of the liver. This is important because there is a significant amount of hormone production that happens in your liver, and having your hormones function properly is incredibly important for long-term health, fertility, and your overall menstrual cycle regulation. Now, the final side effect that I'll mention today is one that I do see quite a bit in my practice, and that is long-term problems with a delayed return of fertility. Now, this is not specifically correlated with how long you've been on the pill, as some women have problems with fertility even after being on the pill for a few months, while others have troubles if they have been on it for many years. The longer you are on it, the more time and focused attention it takes as far as helping to restore and replenish your nutritional stores that have been depleted. Also, if there were any underlying hormonal problems that weren't corrected prior to being on the pill, it takes time to get everything back to baseline and then work on long-term healing to correct that initial concern that was there from the start. In my years of practice, I have cared for or known patients that have had nearly all of these potential side effects in the past, including the scary ones like blood clots, cancers, liver disease, infertility. And certainly, almost all healthcare professionals know of people that have dealt with irregular cycles, nutritional deficiencies, decreased libido, and weight changes when they are on the pill. Now, obviously, not everybody has these side effects on the pill, but you never know what side effects you might have on a particular medication. And overall, the intention should be to avoid any potential harm when there are so many other options for you. There is absolutely no reason whatsoever to be put on the pill. In fact, as a practicing physician for the last 15 years, I strongly believe this so much that I have never prescribed the pill for any reason in my career, because there are always other options for managing your symptoms and for avoiding pregnancy that don't expose you to these potential side effects. There are wonderful options available for charting your cycles, for evaluating your menstrual symptoms in a way that looks at the underlying cause, and for managing your fertility that doesn't expose you to these potential risks of hormonal contraception. All of the side effects that I talked about today, I wouldn't wish on anybody. I don't want my daughters to take these medications. I don't want my friends to take these medications. I don't want you to take these medications. The potential side effects are just not worth it. There is a better way forward. Imagine if there was a way to chart your cycles to avoid pregnancy if that's your intention, rather than being on the pill with its potential side effects. Imagine if charting your cycles and treating the underlying cause of your symptoms allowed you to have more manageable period symptoms while avoiding the harmful effects of the pill. Now is the time to ditch the pill and be empowered to learn more about natural cycles to improve your overall menstrual health. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for healthcare. We are currently able to see people for medical appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa. And we are now also able to offer medical visits via telehealth for patients residing in Illinois. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.